I'm Dr. Dave Bhattacharya. I'm a pediatric surgeon at University Surgical Associates. So I grew up in Memphis, Tennessee, and was fortunate to be able to come back for medical school at the University of Tennessee Health Science Center in Memphis. After that, I was at Duke for general and thoracic surgery residency, where I also did a 2-year NIH research fellowship in cancer biology. From there, I was able to move on to Vanderbilt's pediatric surgery fellowship at the Monroe Carroll Children's Hospital, and have been fortunate to be here ever since. So the field of pediatric surgery lends itself to creating lifelong solutions to problems that children are often born with. I think some of the most rewarding things in my career are neonatal surgeries, so taking care of children that are born with congenital defects and being able to provide a long-term cure, which might last 80 or 90 or 100 years, hopefully, for that child has been a fascinating journey for me. Other areas of pediatric surgery I specialize in are specifically surgical oncology, so taking care of children with tumors, operating on them and providing that continuity of care for them, as well as the medical director of pediatric trauma, so children that are traumatically injured in our community come from 150 miles to be cared for at the emergency department here, and making sure that they have not only the surgical care that they need, but as well as the nursing and other ancillary facilities to make us a level 1 accredited trauma center. So Chattanooga is a great community. I knew that before I came here. I was able to spend some time here as a medical student working with Dr. Burns and the trauma team. But what drew me back is the opportunity to grow, as well as growing with a community that is so deserving. The community, we couldn't do what we do at the Children's Hospital without the community support, and it's really wonderful to work in a place where you really feel like you have the support not only in the hospital but outside of the hospital. Everybody understands that we're trying to provide world-class care for their child right here in the Tennessee Valley. So I think myself and my partners all try and think about what we would want for our very own child. And as I tell patients, as I roll away from them to the operating room, I tell them I'll take care of them like I take care of my very own kid. And I really thank them for the opportunity to care for their child. Well, when I'm not in the hospital, I try and spend as much time with my family as possible. I enjoy fishing. I enjoy just kind of doing outdoor activities. I love to read, and just kind of being in our community, which is a lovely place to be.